The broadcast is now starting. All attendees are in listen-only mode.
This is Danny Bobrow, President of AIM Dental Marketing, welcoming you to this installment of the Practice Perfection Web-Based Education Series. Today's presentation is entitled, Intelligent Healing, Better Oral Health Naturally. Better patient outcomes is a highly sought objective of health professionals. It encompasses several sub-objectives. Among these is a reduction in post-operative healing time, free of complications that minimizes discomfort for the patient. Ideally, it is achieved without resorting to narcotic pain medications, which entail the concomitant risk of dependency or worse, addiction. Today's presentation demonstrates the clinical application of a new technology formulated to improve dental patients' post-surgical recovery after third molar extraction, placement of dental implants, bone and connective tissue grafting, osseous surgery, and other oral procedures. Case studies demonstrate the technology is successful at treating open wounds and accelerates healing by secondary intention. Doctors have found it to be effective in pain management of mucositis, aphthous ulcers, cold sores, dentures, and nearly all other dental procedures. Before we get to this evening's presentation, as always, I want you to know that Practice Perfection webcasts run for around 90 minutes. While attendees are in listen-only mode, we invite you at any time to submit your questions or comments using the question button on your screen. We will allow time following the presentation to get your questions answered. If we do not get to your question during the webcast, we'll see that they're answered shortly thereafter. Attendance at this presentation entitles you to apply to receive 1.5 hours of continuing education credit. Shortly following the webcast, you will be emailed a course evaluation along with instructions on how to receive your CE. Participants are cautioned about the dangers of incorporating techniques and procedures into their practices if the course has not provided them with adequate clinical experience to allow them to perform it competently. We are fortunate to have with us today two much sought-after presenters. It's a 2-for-1 this evening, folks. Dr. Walter Tatch is a board-certified oral and maxillofacial surgeon in private practice for over 13 years. He is a graduate of the University of California, San Francisco and University of Illinois at Chicago. He is a fellow of the American College, American Association, and International Association of Oral and Maxillofacial Surgeons. He is a member in good standing of the ADA, CDA, and American Academy of Cosmetic and Laser Surgery. Dr. Tatch lectures on numerous topics in maxillofacial surgery at local societies and professional meetings. His area of expertise encompasses the full scope of oral and maxillofacial surgery, including advanced hard and soft tissue reconstruction and complex dental implant rehabilitations. He has devoted his career to excellence in patient care and comfort. He recognized early on that every patient has unique and specific needs. With patient well-being his primary focus, he committed to develop and deliver a natural and safe alternative to conventionally prescribed narcotics and steroid medications to help his patients fully recover after their surgical procedures while maintaining optimal oral and overall health. Debbie Zafiropoulos, or Debbie Z as she is known, is a passionate keynote speaker, published author, and tireless healthcare advocate. Recently, Debbie was appointed Partner in Education with the prestigious Wellness Dentistry Network. In 1999, Debbie founded the Oral Ed Institute, a consulting firm which takes science and technology off the shelf into implementation by creating strategies for clients to deliver optimal long-term therapy results while improving the practice's bottom line. Last year, Debbie lost her best friend to an underdiagnosed oral abnormality after battling triple-negative breast cancer. This compelled her to strive to ensure that no family should endure such a loss and led her to found the National Cancer Network, a nonprofit whose mission is to raise awareness of prevention, progress, screening, and referral toward the vision of a cancer-free world, a most laudable objective. Debbie was selected by a committee of her peers in academia to be awarded SunStar's 2016 Award of Distinction for her commitment to the dental profession and her go big or go bigger attitude. I met Debbie at an early AOSH meeting and knew then that she was a major difference maker and someone to watch. Accordingly, we're proud and honored to have both Debbie and Walter present to us today. And with that, it is my distinct pleasure to welcome to the stage, the practice perfection stage, both Debbie and Walter. Debbie, why don't you get us started?
Well, what an amazing introduction, and of course I'm honored to be out here in California, actually, from the warm state of Florida, to be part of this educational opportunity. I know that as we go through the slides and you in the audience get a different perspective and the opportunity of offering our patients something that would give them a better oral health outcome without the pushback with pain medications and side effects and all those other things that we're going to be discussing tonight. I think everyone that's on the call and the webinar this evening is going to see where this particular product is going to be effective in just about the everyday aspect of treating our patients. So I'm honored to be part of this panel of discussion tonight, and certainly anxious to get started.
Thank you, Debbie.
So I think, Danny, you were going to talk to us a little bit about the meaning of Stella Life. Do you want to tell the audience about how the name came about?
Well, I've been working with them for a brief period of time. The term Stella means star, and this is one of the luminaries in the firmament of, I believe, oral systemic health. Anything that can help the practice to encourage patients or to assist patients through the treatment to achieve better outcomes with less discomfort and avoiding the need for reliance on narcotics is as I'd mentioned, is a step in the right direction, and that's why we're very excited to have Dr. Tatch and you on the call.
That's right. Well, for those of us that are familiar with my recent founding of the National Cancer Network, and as Danny said, the reason I started it is because I lost a very dear friend who battled triple-negative breast cancer but succumbed to the underdiagnosed oral abnormality that was found at the base of her tongue, and she chose not to go through the conventional treatment that needed to be done. For those of us who understand a late-stage diagnosis in that particular area, it's pretty radical. And in creating the National Cancer Network and the platform and seeing how many friends of mine are on the webinar this evening, you know that I'm always about the why behind the do and creating an action plan behind it. So once the National Cancer Network was established, being vulnerable and putting ourselves out there, and it's just not me, it's the wonderful people that have joined me to further this message worldwide. We get a lot of phone calls and we get a lot of emails and we participate in a lot of the panels, and of course I speak all over the country and internationally now about the why behind our do and not looking for cancer so that we could find these things earlier. And in that collaboration or in that environment, I've had the fortunate opportunity to speak with several people who were diagnosed with a variety of different effects from a cancer diagnosis. Most of them, as we could probably imagine, is the shock factor in what their therapies may be, but also in the side effects that occur during chemo and radiation. And my very dear friend was given the product by me after I received it from the company and doing my due diligence and actually trying it on myself when I had dry mouth and bit my lip. But this particular friend had gone through stage 4 cancer therapy. She was given 3 months to live, and she, in the past 7 years, has had to have at least 30-some surgeries. And so when we gave her the pain kit, and it's a 3-system pain kit, and as I instructed her to use it, the ability for her to get back to a pain-free environment without being knocked out by some of the strong medications that were prescribed to her was a relief in itself. And so as we progress through this presentation, if anybody has any particular questions, our contact information will be at the end, and I'll be happy to show you the different ways that we're able to triage our patients out of pain, relieving those pains without using a lot of the pain medications that they're afraid to use, and accelerate the healing process. And I think as a clinician myself, those are some of the things that we don't think about. We think about helping the patient get to the symptom, to treat the symptom, but how do we actually help them accelerate the healing long term? And as you get to see some of the amazing cases that Dr. is going to be showing you in the next couple of slides, you'll be able to see how utilizing the Stella Life product line, not only will you help your patients relieve pain, but also accelerate the healing of which we want to do long term for those particular patients. So
Excellent.
I know that Doctor has a lot of cases, and when we were reviewing some slides, I was amazed by them. So I certainly want to allow him as much time as he needs to go through that. So Doctor, are you available right now?
Yes, Debbie. Thank you very much. And Danny too. It's an honor and pleasure to be part of this webcast, and certainly a pleasure and honor to be on the same webcast with you, Debbie. I've heard and read a lot about you, so it's thank you for joining the webcast, and thank you the audience for being part of it as well. We are going to talk about a number of different things today. We're going to review essentially some of the cases, and maybe this is just a handful of cases that we've documented in some of the case reports that we've done over the last couple of years, but they really speak volumes. And as a practicing clinician, essentially I'm faced with the same dilemma as all of you guys. How do we accelerate healing? How do we minimize pain and swelling, and thus allowing our patients to return back to their daily activities quicker? Because let's face it, it is the experience in the office and recovery afterwards to determine how our patients rank us. And ultimately, they will return back to our practice, as well as whether or not they will recommend us to their friends. So what if the solution actually existed? And if I were to summarize what Stella Life products, namely Recovery Kit, and as a freestanding product, gel certainly, and to some extent the rinse as well, do for our patients, it's first and foremost is enhanced healing. Whether it is a quad dentistry, scaling and root planing, or any other dental procedures, and the rinse in combination with gel and can also help acute and chronic periodontal patients as well for long-term maintenance. So let's look at the products. What you're looking at right now is the what we call Recovery Kit. The Recovery Kit has 3 different products kind of combined together, and as you already probably guessed from the name, it is essentially combined to help our patients to recover quickly. Gel is one of the products in the Recovery Kit, as well as a spray. It has 14 active ingredients, mostly derived from plants that have known for the properties of enhanced healing, analgesic, as well as anti-inflammatory, and also their ability to decrease swelling and bruising after the for our patients. It is a combination of those 14 active ingredients that are combined together and working synergistically is what gives superior efficacy to the products. So well, you're probably asking, okay, well, there's 3 different products combined together called Recovery Kit, but when do I use it? So the answer is really for any dental surgical procedure when you're anticipating the patients are going to need to go through some recovery, and by recovery meaning post-operative swelling, post-operative pain, possible bruising as well, but also any dental non-surgical procedures such as scaling and root planing, quadrant dentistry. All those patients can certainly benefit from Recovery Kit as well. So when do we start patients on our Recovery Kit? Well, the recommendation is actually 3 days before the surgery. And the reason being because, well, actually threefold. Number one, you want the patient to get familiar with the use of the products. A lot of patients are familiar with, rinsing their mouths. They use different or have used different rinses, oral rinses throughout their life. The gel and the spray kind of have a little bit of, you're going to have to do a little bit of explanation. So certainly the patient going through those products and starting to use them 3 days before will eliminate a lot of unnecessary calls to your office. Another reason, a very actually important reason, is because you want the patient to build up to therapeutic levels before the procedure. Another advantage of the product, one of the 14, as I mentioned, active ingredients that is in Recovery Kit, also has anxiolytic properties. So certainly reducing anxiety before the surgical or any dental procedures would be very welcome for our patients. So this is basically how the spray is utilized. The patient raises their tongue, and the spray is very, very easy to use. The delivery it essentially delivers a steady dose in the particles to the sublingual mucosa, which gets absorbed into the systemic circulation. The gel is also fairly easy to use. It's so the spray is working systemically while the gel is working locally, and the patient is instructed to apply it with a Q-tip to the mucogingival junction, as well as to the site of the surgery or future surgery if we're starting 3 days before the procedure, before the surgery or any procedure, and the patient continues the application after the procedure as well. So in a very busy life, you're probably thinking, okay, well, this guy's telling me about 3 different products that I have to explain to the patients how to use it. So we want to really essentially explain to the patient and make it as easy as we possibly can. In a busy life, it's hard to find time. In my office, patients are instructed to use gel and spray at the same time. It's very easy. The patient sprays under the tongue. Immediately after that, they apply the gel at the site of the procedure or the site of the surgery. And the rinse can be used 3 times as well. In fact, all 3 products can be used at the same time. In that case, recommendation would be for patient to rinse their mouth for about a minute, and then apply the gel and the spray after that. Okay. So in the rinse, you're all very, very familiar with how to use rinse. We do recommend patients to use the rinse after meal and as well as at bedtime. And as we just talked about it before, the rinse could be used, all 3 products could be used together. The rinse is used first, and then the gel and the spray afterwards. The patients are usually asked not to eat anything for at least 15-20 minutes after the application. And when I share with you in later slides, and essentially Debbie will go over some of the case reports and case studies that we've done, and she'll show where the efficacy of the rinse at its peak. You'll understand why the patients are instructed usually not to eat for at least 15 to 20 minutes after the use of the products. Okay,
so doctor, if I could just share one thing on the previous slide that you just showed us with the kit. You know, one of the benefits for our patients is, you know, when we identify what their risk factors are in the treatment that we want to provide for them, whether it is a simple extraction, whether it is scaling and root planing, whether it is a child or an adult going through orthodontic therapy. You know, all of those are opportunities in which utilizing the Stella Life Recovery Kit is applicable. In the cancer realm, or in helping patients get out of pain, when we can implement the use of this product prior to them going into a situation which may cause them pain, it's an amazing relief to them, knowing that they're going to go home with everything that they need in order to prevent them from being uncomfortable. And I think that as a clinician and as an educator myself, that's one of the greatest tools, that's one of the greatest feelings I could help, is knowing that I am educating my patient to not be in pain from something that I may need to do with them, for them, to treat whatever condition they're in. And I can't tell you how many times that I've dispensed this kit out to people that I've talked to, and immediately they're calling me back saying, why doesn't my dentist know about this? Why isn't my dental hygienist educating this? Why isn't this in the pharmacy that I go to? And I really think that if we apply what we do chairside with our patients and identify there are products such as what Stella Life is offering us to help our patients prior to getting into pain, it makes their long-term healing and their long-term recovery that much better. And I just wanted to put that in there. I apologize for interrupting you, doctor, but I wanted everyone to understand the application isn't just when the patient could potentially be in pain, because we know it would take them a lot longer, but to identify the opportunities in ortho, in simple surgeries, in scaling and root planing, and that we could utilize this technique in this product.
Well, I appreciate it. That is a very, very important point, and thank you for your comments. So we're going to continue with the recovery kit. So bear with me the next number of slides. We're going to essentially go through case studies and some case reports, but this is just kind of important to illustrate the efficacy of the product, how it works, and some of the case reporting that we've been able to accumulate to date. So the first case study that we did was on wisdom teeth. We essentially took a look at 10 patients. They're all healthy teenagers undergoing removal of wisdom teeth. And as part of the study, a group of 10 patients had routine removal of 4 impacted wisdom teeth. One of the criteria for this was for the study to qualify was that they couldn't take any steroids or non-steroidal anti-inflammatory medications for about 2 weeks before the procedure. They were giving post-operative for post-operative pain. They were all giving Norco and Stella Life Recovery Kit, and as well as the daily kind of diary questionnaire, which is called HRQL. It's a well-documented tool for gauging the patient's recovery in a number of wisdom teeth studies that have been published at the American Association of Oral and Maxillofacial Surgery magazine has used those studies as well. So we had the patients come back in 7 days and share with us their recovery that they were recording on a daily basis. Okay, there we go. So in this particular graph, you see 1 week, essentially a 7-day recovery for the patients who were using Stella Life Recovery Kit and Norco. and it's reported the number of norco-pain medication the patient utilized on a daily basis, the averages. In this case, on the day post-operative day 3, the patient only used 0.8 pills of Norco. Usually, the peak pain is kind of around 3 to 4 days. That's well documented from other wisdom teeth studies, also from my clinical experiences prior to using Stella Life recovery kits. So in this particular instance, for when we're measuring the post-operative pain and we're measuring it by the number of Norco pain medications the patient took, we're looking at least 1 to 2 days quicker recovery and a lot less Norco pain medications the patient needed to take. In this next slide, you're looking at how the patients rank their recovery based on their dental health. And again, we're looking for the pain, swelling, and discomfort to be kind of around peak levels at 3 to 4 days. And by utilizing Stella Life Recovery Kit, they were actually 75 to 80% recovered by day 3 to 4, which is kind of incredible. Again, at least a couple of days quicker recovery based on the use of Stella Life product. So what it essentially means is that those patients who utilize Stella Recovery Kit were able to return to their daily activities much quicker, at least a couple of days earlier than they would normally would be able to, and they took fewer pain medications. So the next case report I wanted to share with you is the actually a 3-patient case report where we looked at Stella Life Recovery Kit used for patients who underwent significant reconstruction of severely edentulous mandibular ridge. The patient underwent GBR, which is guided bone regeneration, as well as using titanium mesh and bone morphogenic proteins to reconstruct the patient's defect. So this is the patients were recalled basically for 1-week follow-up appointments, and we kind of looked at their recovery. So in this slide, we're looking at the post-op CT scan, and we can appreciate the amount of vertical and horizontal reconstruction these patients have undergone. Essentially, what you're looking at is the attempt to increase the height of the bone by 6 to 7 millimeters and width by 8 to 9. Think about the amount of dissection of soft tissue that is required to cover the new height and width of the bone. We're essentially creating a very, very tall tent pole and trying to bring the soft tissue over to cover. The more dissection we're doing, of course, the more swelling and pain the patient will experience. And to that, add the use of bone morphogenic protein, which those of you who are not familiar with the product, even though it allows the patient's own bone to essentially form de novo, what we call, it causes a lot of swelling. So patients usually swollen for 3 to 4 weeks easily after use of that product. And look at this slide on the right-hand side. This is a 1-week post-op slide where the patient shows very minimal or no edema. The tissue looks like it's healed for at least 3 weeks. Let's look at another patient. Similar results. Again, this patient underwent a significant ridge reconstruction. We used the same technique, the same titanium mesh using BMP. Look at that tissue. It looks like it's been healing for 3 to 4 weeks. You can hardly tell that there was any surgery done there. And again, we increased the height and width of the bone significantly. Very involved surgical procedure, a lot of manipulation of the tissue, and we would anticipate for the swelling to be a lot more advanced even at 1-week post-op appointment. Same kind of results. This is a patient that underwent bilateral reconstruction. You're looking at the left side, significant atrophy, and again, a week post-operative, mild edema, but certainly well in its way of healing. And considering the amount of surgery the patient underwent, is very, very insignificant. And you're looking at the right side right now of the same patient. Okay, so let's switch gears. So now we talked about use of Stella Life recovery kit for to help the patients recover quickly after big reconstruction surgeries. But again, I just want to draw the parallel. It doesn't have to be advanced surgical reconstruction. It could be scaling and root planing, as Debbie mentioned. It could be quad dentistry and a number of other different procedures. Let's take a look at this case where the patient was helped significantly by using of Stella Life Recovery Kit. You're looking at the patient's buccal mucosa. It's on the left-hand side. And essentially the patient develops mucositis from long-term use of steroid inhalers. This left side lesion was treated with recovery kit, and the patient, the picture you're looking at the right side is essentially 1 month post-op, which shows complete resolution of the lesion. So recovery kit was able to essentially completely treat the mucositis the patient presented with a month prior to it. Let's look at the other side. This is a much deeper lesion and much more advanced. Same patient, and you can see that on the right-hand side, even though this part of the lesion is still present, but it's 80 to 90% improvement, which is quite significant. I can tell you that mucositis is very difficult to treat in clinical practice, and it certainly would not anticipate this kind of resolution in a month if we put the patients on Feridex or any other or any antifungal medications. All right, moving forward. So this is another case, another surgical case, and what you're looking at the CT scan is basically a full bony impacted canine that has a large cystic lesion associated with it. As an oral surgeon, we see these cases quite frequently. So what this patient is going to need to undergo is the removal of the cystic lesion, removal of the impacted canine, and we're planning on doing the reconstruction as well right after the removal of the cyst. So let's look at the amount of dissection and manipulation of the tissue that the patient had to undergo during the surgical procedure. You're looking at the incision line and essentially a bony defect after the lesion was removed. And on the right-hand side, you're looking at our reconstruction bone graft, and then this is membrane before the surgical site was closed. The patient was recalled 1 week later, but before that we did a post-operative CT scan kind of to see what the amount of reconstruction, and you can see this is immediately after the surgery. The bone graft, you can see filling the defect that was left from the cyst and the impacted canine. So let's take a look and see what the tissue looked like a week later. Look at this incredible healing. This patient looks like it's been healing for at least 3-4 weeks. You can hardly see the incision line. There's no edema, there's no erythema, and the tissue appearing to be completely normal. Remember, there was a lot of dissection and manipulation of the tissue. I would anticipate for this patient to have a lot more swelling at this point in time and be some discomfort. So then we asked the patients what about their recovery, and this is what they're able to share with us. That natural recovery kit you gave me was magical. I had hardly any swelling and bruising. I took only 3 pills of pain medications. That's it. Those are the powerful, very powerful statements from the patient. This particular patient drove to see me almost an hour after having a few consultations with other oral surgeons, and considering the uneventful recovery and how quickly she healed, she will definitely tell all her friends how quickly she recovered, and will be recommending our office. Remember, patients do not really know how good of a prep we did on their crown, future crown, or how meticulous of a procedure we performed. They usually decide whether or not we're good clinicians based on the amount of pain they have during the after surgery. So I feel that recovery kit definitely gives me an edge, ability to accelerate patients' recovery, no question about it. All right, so we are now going to move from recovery kit to actually one of the components of the recovery kit, that's the gel. And that component is available as a standalone product. As we talked about it before, it has 14 different active ingredients. They're all very well described in the homeopathic pharmacopoeia of the United States. And aside from treatment, immediate treatment of post-procedural or post-surgical side, it can definitely be used for mucositis, aphthous ulcers. In fact, in my clinical practice, patients who use Vega gel recovered within 48 hours after aphthous ulcers initial presentation. It could be used for cold sores and dry sockets. All right. Well, how do we use the product? In this particular video, you will see essentially what we call all-in-6 technique. So this patient underwent a removal of all remaining upper teeth. She had a quite advanced alveoloplasty done, and we placed 6 implants and actually did a sinus lift as well. After that, the surgical site was closed, and now we're going to take impressions and wait for the temporary prosthesis to be fabricated, which usually takes about an hour before we can actually deliver it. Prior to use of Vega oral care products, especially gel, I have to tell you that the biggest dilemma was with these patients, because 50 minutes to an hour wait period, the tissue would swell up significantly. We would put the patients on the ice packs, but it would help very little. So let's look at first at the application of the gel and how we use it for what we call in-office use, and then we'll look at 15 minutes later. Okay, we just finished surgery and we're going to apply the gel. Okay, can you open just a little bit more? So this is how the gel is applied essentially over the surgical site, the incision line, and in the vestibule. And look at 50 minutes later. This tissue looks like it's been healing for at least a couple of days. The swelling is minimal. There's no erythema and hardly any bleeding. This is the tissue that's very, very easy to work with. And imagine what the gel can do for, let's say, a crown prep before you pack the cord. If you put the patient on it, if you apply it for about 20-30 minutes prior to packing the cord, the tissue will respond the same way. All right. So more surgical slides. So I just wanted to make a point that we're looking at a few selected cases, case reports showing the efficacy of the product after advanced surgical procedures. I know many of you are saying I don't do any of those surgeries. So the point is here is to draw a parallel actually and understand that Vega line of products have many applications throughout the dental field. No matter what kind of procedure you perform, Stella products will allow your patients to heal and recover much quicker, while also providing a natural antimicrobial rinse that will not stain patients' teeth and alter their taste. So let's go back to this case. On the slide on the left-hand side, you see essentially two pictures of the CT scan screenshots. The one on the top is preoperative, and the one on the bottom is postoperative. So this patient has severe bony atrophy of the upper edentulous ridge, and she is undergoing reconstruction, in this case bilateral sinus lift, so we can recreate some bone for us to be able to place implants in the future. So the incision line was placed essentially from the tuberosity on the right side to the tuberosity on the left side. Full thickness flap was elevated, and we finished the sinus augmentation on the right. Then we went ahead and closed that side, applied the gel, and went on to working on the left side. After we finished, about 50 minutes after we finished the surgery on the left side, we kind of step back and look at the difference. And look at the difference the tissue, that the gel made on the tissue. You can see the, again, immediately finished surgical side on the left-hand side, and the right looks like, again, it's been healing for some time. This is incredible result. I think that there's really no other product that can do this, that can make this kind of difference in about 40 minutes. Imagine what it's going to do when the patients are using it on a daily basis for their recovery. So let's look at another case. Again, the gel here, where we're still discussing the Vega oral gel. In this particular case, the patient, there's a little bit of history here on the figure 1. You're looking at the initial presentation, and this was actually a cancer survivor, a patient who had squamous cell carcinoma in one resection, and so certainly coming in for annual checkups. So now we're seeing some redness and issues on the left retromolar pad. Certainly warrant some further investigation. We went ahead and did the incisional biopsy. In figure 2, we're looking at 1 week post-op. So the diagnosis of mucositis was established. Thankfully, there was no squamous cell carcinoma recurrence, but it's still a troublesome looking lesion, and we're looking at possibly putting the patients on antifungal medications. But instead, we decided to do the rinse and the gel application for a month, and figure 3 shows complete resolution of the lesion. I have to tell you that in this particular case, the both rinse and the gel kind of saved unnecessary additional surgical procedures for this patient. All right. So I'm going to go through the, there's a number of clinicians that have used Stella Life products with kind of reporting very similar results. And this is just essentially a summary from Dr. Jason Stoner, who is a very prominent periodontist in Ohio. He's been using this product for at least a year, and he completed a 50 case report study when he looked at use of Stella Life products after various surgical procedure, mostly connective tissue grafting. And what he concluded is that there was definitely significant anesthetic pain relief. The patients were healing faster. In 1 week, Stella Life site looked like 1 month, which is very consistent with what other clinicians are reporting and what I've seen in my clinical practice as well. He did some controlled studies with Peridex, PRGF, Periscience, PRP, and MD, and we'll look at some of those clinical slides in just a second. He also said that as a clinician, the site that where the patient used Stella Life products had just simply less problems. His comment was, I did not have to pay any attention to it at all because I knew that that site was healing just fine. The pain level of patients was 5 or less first day, and then went down to 3 as compared to what is anticipated after procedures like he was performing would be about 7. And the patients unanimously reported having less problems with Vega treated site, which is exactly what we see from our personal experience, patients coming back and reporting on the their experience with Vega products. So we're looking at some of the clinical slides here. The one on the left is the patient, a 1 month recall. Patient was using Stella Life product on the left-hand side. On the right-hand side, they're using, it was a control using PRGF. So PRGF was applied immediately intraoperatively and immediately post-operatively to the surgical side. And you can see the right side is still healing, or the slide on the right side is still healing. It's actually the upper right quadrant. The lower right quadrant appears to be completely healed, and again, that's the site of Stella Life. where the Stella Life product was used. Let's look at another case. Similar results. We're looking at, again, the difference between Stella Life and, again, control using PRGF. You can still see erythema on the control side that had PRGF used, and significantly advanced healing on the Stella Life side. In this particular case, he used the control again, PRGF. Very similar results. Let's take a look at this one. This is control using Peridex. Looks how much more redness and edema is on the control side that the patient used Peridex on, and how little inflammation and advanced healing on the side of the Stella Life. Another case in this particular, this was I believe it was a pinhole procedure, connective tissue grafting for the canines, Stella Life versus PRGF and Peridex, and again, significantly less erythema and less edema on 1 week post-operative recall visit. Another canine site, this was PRGF, and very, very similar results. In this, this was interesting because here Dr. Stoner kind of used Peridex, and another rinse that's and the gel available is Periosines, and he compared it to the Stella Life product. You can see significant difference on the Stella Life side. Again, probably half of edema, very little erythema, and significantly more advanced healing on the side of Stella Life. All right. Well, we're going to get in towards the end of my presentation, and what I will finish with is a problem case that kind of illustrates how Vega products work. Not when everything is not going our way, and as a clinicians, you know, we're always trying to do the best we possibly can. Sometimes things don't go exactly as planned, and in this particular case, what you're looking at is a routine connective tissue grafting. On the left-hand side, you can see the patient's initial clinical presentation. A small defect that before changing the crowns on the anteriors, the patient needed to have a connective tissue grafting done. So uneventful procedure, actually it was a flapless or tunneling technique that we used. We used Alloderm, and the patient was supposed to come back in 3 weeks. Well, the issue is the patient decided that I left something that wasn't supposed to be there, so she found the edge of Alloderm and took a pair of tweezers trying to kind of remove it from the surgical site, and this is the result of her attempts. I mean, you're looking at the patient as a clinician, we can all appreciate. This is someone who has a high smile line, a very difficult patient personality-wise too to deal with, and she comes back in a week kind of looking like this. I mean, this is has a disaster written all over it. And of course, I'm out of town at this point in time. This was kind of early on where we're just introducing the Stella Life product to our practice. So my surgical assistant actually took a picture, and of course the rest of my trip was not the same after seeing that picture. And the only thing I could recommend at this point in time is let's go ahead and try to give her the gel and the rinse. If you ever dealt with Alloderm, which is a cadaver dermis, when it gets exposed, the patient also experiencing malodor. I mean, it really stinks quite a bit. So the patient was complaining about that as well. And when she smiles, you can see that exposed alloderm pretty much all the way to mucogingival junction. The one on the right-hand side, actually, to my amazement, was when I came back a week later, and this is her just using Vega oral rinse and gel applying to the surgical site. This site is granulating and healing, and if I can, all right, hang on. We're getting there. There we go. And this is 10 days later. We got a complete healing of that surgical site. I mean, talking about saving a day, I mean, this product really saved me in this particular case. The product in general has been used in my office for the last few years, and has been making a difference for my patients on a daily basis. In my presentations, I shared with you just a handful of clinical cases, of course. In the pilot study, there are more cases, case reports on Stella Life website, and we have a number of them growing as more clinicians are sharing their success stories with us. I hope that you will be able to see yourself how Stella Life can make a difference for your patients as well.
Thank you so much, Walter. That was remarkable, especially that last illustration. And yeah, let's let Debbie sort of bring us home now with some final observations. Go ahead, Debbie.
Well, I think, you know, in writing my notes and, you know, adding to the Stella Life encyclopedia that I have at my desktop, as a clinician, dealing with patients that have chronic inflammation and issues with their tissues and issues with biofilm, now that I have something that's easily obtainable, easily implementable, and showing the patients that they have an opportunity to participate in their long-term health and healing, I think that everybody that's on the call tonight and people that who will log back in and listen to this information again will see how the positioning of the Stella Life product line will help in the applications in which we struggle with our patients. Doctor had mentioned, you know, anecdotally about the comments about the Stella Life product line since it's been on the market, and I get alerts all over the internet all times of the day and night from different organizations, and one that came in was from Dental Advisor. And I think that if you follow some of the things that they put out into the public and ask for feedback, you know, Dental Advisor gave Stella Life a 91% clinical rating, and the clinicians are raving about how it's a problem solver in their office. As a clinician, I've been a dental hygienist and a clinic owner and an administrator for a very long time, and one of the products that we were conventionally using, because it was the only thing out there, was chlorhexidine. And, you know, everybody's probably cringing, and the first thing that, you know, we recall the patient calling about is the taste. You know, if it doesn't taste good, they're not going to use it, regardless if we say how beneficial we think it could be. The other objection of that would be staining. You know, we want the patients to be looking good after we've created an opportunity for them to heal, and with Stella Life, you will not get that type of staining. But the healing of the tissue is something that maybe with the amazing pictures, and I know I like the juicy red surgical pictures and the sinus lift pictures that Dr. so eloquently shared with us, but think about the overall long-term healing of the tissue. I mean, the way that healthcare is going right now, reimbursement for recare, for retreatment isn't there. And so allowing our patients to choose the option of hydrating the tissue, promoting the healing of the tissue and the surgical areas, reducing that chronic inflammatory burden it's so empowering. You know, one thing that we may or may not have mentioned is xerostomia. You know, and the different levels of understanding that patients have in xerostomia, whether it's from chemo or radiation, whether it's from a systemic disease like Sjogren's or underdiagnosed, undertreated diabetes. I mean, we can list the symptoms that our patients are presenting with, but now we have an opportunity to go to the cause of the problem and allow our patients something that's going to help overall long-term care. The rinse I started using myself, I've had some issues with dryness, and I bit my lip, and it wasn't healing. So when I got back from Chicago this past Monday, I started using the oral care rinse. And think about what we're trying to achieve with our patients. And just from reading the slide alone, you're looking at 4 active homeopathic ingredients, but the next sentence, a study showing that it kills 99% of strep mutans. So what's the relevance of that? Well, if we understand biology, if we understand what strep mutans actually does, it releases, well, strep mutans is a biofilm that adheres to the carbohydrate layer, the sugar layer that's on the side of the tooth. And we're talking about all surfaces of the tooth, even underneath the gum tissue, okay? And as it feeds on that level, it releases lactic acid, and the lactic acid is what causes the hole we call a cavity. Well, if we eliminate the presence of strep mutans, and in this particular study, killed it at 99%, we now have the opportunity to educate our patients about preventing dental disease. Wouldn't that be exciting to have your patients recommend other patients, recommend their family members to come to your office because you're actually preventing disease? So when I do my courses throughout the country, and again, as I mentioned earlier, I'm in here at California doing the Care Harbor volunteer aspect, I am training clinicians from UCLA, from the dental school, the ENTs, the hygienists, about triaging our patients by identifying the risk factors that will cause your patients pain, inflammation, infection, loss of tooth, loss of life. And now we can do that. Think about it. Now, I'm not a millennial, unfortunately, but I'm trying to get back there, trying to reverse my aging process a little bit. But if we take a look at what technology has for us, and this is something called a breathometer, and what this particular device was able to do is help our patients understand the why behind our do during our clinician chair time. This measures anaerobic bacteria. Think about it, not just those volatile sulfur compounds that make their mouth smell not so palatable, but think about the opportunity of educating our patients about in-between maintenance of those risk factors that will cause them a problem. So in using the breathometer, we were able to identify, in conjunction of using the Vega Oral Rinse Gel, we're able to reduce that anaerobic bacteria after 3 hours of its initial application. Well how do you do that? Well, think about how you're recommending your patients to use those home care products. Now, in the offices that I consult with through the Wellness Dentistry Network, we are advocating that you identify the cause of the problem and dispense to your patients the products that are necessary so they're not going to those super big box chains and getting confused about a price point versus active ingredients and long-term success. So in this particular case, you're going to see that dispensing the Cellulite rinse will help your patients reduce anaerobic bacteria for 3 hours. Now, when I dispense this to my patient, as I use it myself, I use it right before I go to bed at night. Brush, floss, use my rinse, go to sleep, and while I'm sleeping and as I'm salivating all that last, those beneficial attributes of this will reduce the anaerobic bacteria, as we mentioned earlier in this particular study, for 3 hours. So rinse, don't eat or drink anything for 30 minutes. So again, think about your patients. You know, they're watching Dancing with the Stars, they're eating ice cream after they brush their teeth. No, have them use this right before they go to bed so they don't have to worry about any type of washing out or not getting the beneficial effects to it. So I know, Danny, we're probably coming to the end of our time together, so if I could just do a quick overview in how I see my response, how I'm getting the responses back from the patients that I'm consulting with. As I talked to a dentist on the plane here, and hopefully, I think I saw him on the webinar tonight as I gave him the address. But if we think about a drug-free pain relief, an opportunity for us to offer our patients something that is more natural, something that won't create an adverse drug reaction with any of the other medications that they are using, have them not be so worried about taking a narcotic and getting, you know, the things that are in the newspaper about getting addicted to something that will not give them a long-term healing effect, let alone pain control effect by using those particular products. Compliance is always the issue. And I truly can tell you from the depths of my soul, from the patients that I've talked to, the people that I had given the product to, their response is, why hasn't my doctor told me about this? I go to an amazing hygienist. Why didn't she tell me about this? Well, this is why. We are now educating the masses on the opportunity to provide the Vega Oral Care Recovery Kit whether you're using the rinse specifically for patients with scaling root planing, whether you're using the gel with patients who are going through orthodontic therapy, whether you're helping a patient triage out of pain from chemo radiation. I think if you take a look at the website, you'll be able to identify how the cases that Dr. so eloquently and so amazingly presented tonight, you will see in your head a Rolodex of those patients that you wish you had this product with. Because I know every day that I talk to somebody, I wish I would have had this in my arsenal. So I don't want to keep us any longer. Of course, I could forever. But you know, if you have any comments or any questions before or after, excuse me, not before, but definitely after this presentation, and please don't hesitate to reach out to us. I think the website will be up. You know, go to the website and ask any questions, or give us a call, and we'll certainly be able to you know, help you in any way. But again, you know, think about it: dry mouth, lichen planus, chemo, ortho, sinus lift, mucositis, scaling root planing, extraction, 6-on-6 implants. I mean, an alternative to antimicrobials that may cause stain, that don't help your patients get out of the pain cycle. I'm just so amazed at the information that we were able to pack into their time together. And please go to the website, do yourself the justice of taking a look at what Stella can do for you and for your patients. I can tell you, for me and for those that I've recommended it to, it's been a game changer. It's been a lifesaver, and they're so thrilled about it.
Well, your passion and commitment to the based on your own personal experience is obvious and contagious. So I want to thank you and Walter, of course, for sharing the science, the treatment, and perhaps most of all the results of this product line. It's remarkable, and I have to share that even though I've been kind of close to it, working with Stella Life CEO Gennady and Walter and you, Debbie, that I had no idea that the range of applications was as broad as it is. And I think based on the questions and comments that we're receiving from the audience that I'm not the only one. It's truly remarkable, and it's really a great way to improve practice outcomes while creating raving fans of your patients, because they know when, you know, hopefully they don't have too many experiences with surgical procedures, but with healing time like that, without relying on these narcotic medications, who wouldn't want to share that news far and wide? So thank you both again. Now, I do want to, in the remaining time, we've gotten a lot of questions. I will try to get to as many of them as possible. Some of them are variously on how to learn more on how to get started. And basically, if you're both dialed in and logged in, you can see on your screen the information you need to learn more. I will share for those of you who are just calling in and not able to see, the screen shares that you can learn more by going to the website, which is stellalifehealing.com. That's S-T-E-L-L-A, lifehealing.com. You can also call 800-828-7265. There's also a rather long promotional code, but it's worth remembering. It'll offer you a 30% discount, and that code is 30, the word off, 1182017. And I should let you know, if you didn't quite get that, everybody that registered will be receiving a post-event email that will not only share that information, but also how to apply to receive your CE. Let's dive into the questions right away. And but before I do that, I wanted to mention too that the company offers a team of senior product specialists. And so they're not just order takers. They will actually work with you and support your team with training to ensure that you know how to use the system and the protocol. Although, as you've seen, it isn't rocket science. Developing it may have been, but applying it doesn't seem to be very, very challenging. But there does need to be some compliance on the part of the patient, and for that reason, the company has made available these senior product specialists to work with you and answer any questions or address any concerns that you might have. So here are the questions. First question is, are these products covered by insurance? And whoever wants to take it away.
Well, I'll jump in. I think I beat doctors to the punch. Everything
anxious.
comes around to have, yes, I am. I'm just so whipped up about this. I want everybody to get it in their practice tomorrow. But everything comes down to insurance, and, the vacillating question with insurance is, what plan did the employer buy for that particular patient? We do, and there are dental codes that will apply for utilizing this, but reimbursement is always the typical, well, how much does my insurance cover for it? I think that once your patients identify the benefit of it, it's very inexpensive for the success that they're going to achieve with it. So, but there are dental codes that I think with the training that's going to have when an office implements that, we'll be able to go through with that.
Yeah, and I would imagine that this, I guess, is technically elective, but I think if it's presented that, well, it's up to you, but would you like to heal in 1 week or, 4 weeks or 1 week? Basically, and just have at your ready the documentation and the case studies, I think would be an excellent communication and selling tool to help people make a decision that really is truly in their best interest. Next question. Well, this is a question that I have actually. Based on what was shared, this was one of the things I didn't realize, but can your product line actually help with prevention? You mentioned frequent oral care regimen, Debbie. That there are oral high-risk oral pathogen testing, saliva testing services available, and I'm just wondering if consistent use of this as a prophylactic measure can actually help reduce the presence of these high-risk pathogens.
Yeah, that's an excellent question, Denny. I'll take that. But the rinse is definitely for long-term maintenance. There's no question about it. And incorporating into your normal daily routine is going to make a profound difference in your oral health. The gel can certainly be used. Can be used for someone who has perhaps maybe some inflammation or periodontitis, for short to moderate term use to decrease inflammation, get the periodontal disease under control. But the rinse can definitely be used. It's one of those products that can be used forever and ever.
Excellent. Does Vega Oral Care require FDA approval?
So the Vega, the products are FDA monitored. So because all the active ingredients are well described in HPUS and have over 200 some years of track record, the FDA does not really require the actual approval, but they do monitor very closely, and all those active ingredients that are part of the both recovery kit and all the individual products are part of HPUS, and like I said, he has had over close to 200 cumulative years of clinical application.
All right, and a couple people asked this question. Well, I know what PR, and I had the same question, except I believe PRP is platelet-rich plasma. What is PRGF?
It's platelet-rich growth factor. It's pretty much it's very similar. It's just a different mode. It's still the same process. It's autologous, comes from the patient's own blood. The process is a little bit different. So some studies claim that there's more growth factors. Some studies claim that, depending on what company you listen to, but the science behind it is pretty much similar.
I see. Can I substitute chlorhexidine with the Stella Life rinse?
Please do, because I switched a number of years ago, and the truth of the matter is, if you look at chlorhexidine is a certainly antimicrobial mouth rinse, and I've been using it, or I had used it in my practice for years because there was nothing else, and that's one of the reasons we started looking at different products, because of what it wasn't doing. So it wasn't, as a surgeon, you hope that everything, post-surgically works great. great, but sometimes if you have a little dehiscence of the surgical wound, there's actually studies that show that chlorhexidine can decrease the fibroblastic activity, thus actually slowing down the healing process. So that's one of the studies that's probably not very well publicized, but it was published about in 1985, and there's been a number of other studies that came out a number of years ago. So so that's from the surgical standpoint, but certainly from the patient's experience, staining of the teeth, and Debbie can attest to it. Seeing patients after they used chlorhexidine for a little period of time, makes her job very, very difficult. Not to mention that the altered taste that chlorhexidine, a lot of patients will complain about.
Mm-hmm.
So,
did you want to? Oh, sorry, Debbie, did you want to add anything to that?
Well, I agree with, being a clinician and having to educate the patient on long-term care and what the patient's responsibility is to maintaining that constant flow of crevicular fluid to decrease that biofilm. Utilizing something that doesn't taste good, costs too much money, stains their teeth, and gives them a metallic taste, it's a no-brainer that they're going to come back failing. So once we made the switch, once the clinicians, tried it themselves and more importantly, saw the results, it's just an easy segue into utilizing this product. And again, we're looking at something that is falling into the realm of homeopathy. And again, patients are looking for that. I don't, think that I'm the only one on the call tonight that doesn't see that our patient long-term care protocols have shifted into learning more about all natural products, about probiotics, prebiotics, and things that we can help our patients use long-term. The other great thing, utilizing the gel, if the hygienists and even the general practitioners there that are utilizing scaling, root planing, and air polishing, and those type of things, when you can apply the gel on the gums after scaling and root planing, and the patient's going home and their mouth feels cleaner, they feel fresher, their breath is fresher, and then, wow, they go home and their gums aren't swollen and red. I mean, it's empowering.
Yep, I can see where that definitely is in marketing parlance a practice differentiator, to be sure. Next question, do you know of any side effects, including staining?
Well, we've had the product, actually we did some studies on staining. We took a bunch of teeth and kept it in Vega Oral rinse for weeks, and they didn't change the color, and the track record of two plus years, the answer is no. As far as side effects are concerned, there's active ingredients that are in all the products, and certainly if a patient is allergic to any of those ingredients, they should not be utilized, although most of the products are topical, except for, of course, the spray that gets absorbed in the patient's circulation. But again, those active ingredients have had a very long track record, a very long safety track record, and are very, very safe to use. So I'm not aware of any problems associated or side effects, aside from, of course, if anyone is particularly allergic to any of those active ingredients that are part of the Stella product. And I just also want to say that it's the synergy. All those ingredients are certainly well known, but it's a synergy, and it's a combination of the 14 active ingredients kind of potentiating the effect is where you get the most efficacy, and so that's kind of the uniqueness of that product.
I guess I would have a follow-up then. Would it make sense then, before administering the product, whether accepted by the patient or not, to update your patient intake form or health history to include questions about the ingredients, just to confirm there's no allergic reaction?
Sure. I mean, we you can't list obviously everything that's under the both medications, allopathic medications, or food allergies. I mean, when you ask, the medical form should be updated. I mean, my office, we update it every 6 months. I don't see patients on a regular basis. As a surgeon, we do surgery, sometimes for annual checkups, but every 6 months to a year when they return, they fill out the questionnaire. So if there's any particular allergies, whether it's food allergies or anything else, there's a space for them to mention it. So asking if they're allergic to all those particular active ingredients, it's certainly possible to ask, but if the patient is not reporting any allergies, I'm not sure that you need to list all 14 ingredients and ask, just like we're not listing all the allopathic medications that are known to the mankind. We just simply ask the patient if they have any allergy.
Okay. Sounds like would be a case of overkill. Have you had any problems with osseointegration of implants after initial healing? Not sure why that might be the case. It seems like they'd be independent of one another, but somebody asked it, so thought I'd share.
Problems with integration of the dental implants. Well, the product really is not, talking about dental implants, my protocol, if it's minimally invasive, and you saw the application of, it was a little bit more involved case where you saw the video of all-on-6 where we did the, quite a bit more. We did extractions, we did viloplasty and things like that. So we, in fact, after any procedure, we do in-office application of the gel, because even if the patients are coming in on an emergency basis and haven't had a chance to start 3 days before, we apply it right after the surgery, and to get early start on the healing. As far as the implants are concerned, for maintenance, I recommend patients using a Q-tip applicator and just soaking in the in the Vega Oral rinse. They kind of apply it in a clockwise fashion, not to disturb the healing abutment, but and also for long-term maintenance too, they're rinsing. But also, I recommend the patients to use a Q-tip applicator right at the mucogingival junction where the crown gum interface of the implant is, and applying it directly there, which I think is a good idea, especially as Debbie mentioned at bedtime, because then you have the gel kind of sneaking under the in the pocket and providing that its antimicrobial properties. As far as integration of the implants, I'm not sure that has anything to do with the products, or it's more of either patient healing or compliance. I'm not sure how to answer the rest of it.
I mean, honestly, I would imagine that if anything, the quicker you heal and close up the wound, the less likelihood for infection, which should lead to better outcomes in terms of osseointegration in particular, and just the success of the procedure in general.
Yeah, no question. I mean, the recovery kit and or gel will help with the initial recovery, and the rinse is going to help them maintain the site and provide antimicrobial coverage there.
And then I have a forward question, which is sort of mine too. The question is lichen planus and pemphigoid?
Pemphigus.
Yes.
I guess we're looking for definitions of those terms.
Yes. So lichen planus and pemphigoid. In fact, one of the slides that early on with Debbie was talking about squamous cell carcinoma. Was actually a patient. Was a patient with the erosive lichen planus. Both of those conditions you just mentioned are autoimmune conditions, and certainly very difficult to manage. The usual protocol would be to have patients be either on the topical steroids such as Lidex gel, and then if they have exacerbation, oral steroids. Clearly, a lot of side effects with those products. To answer your question, we're looking at the use of the gel and the rinse for patients like that, and I can tell you that so far it's anecdotal, but we have 3 patients that have benefited significantly. I certainly, in my clinical settings, I have a number of patients, especially with erosive lichen planus, who are coming annually for checkups, and one of them developed a new lesion that required biopsy, and for postoperative recovery, she was using the gel, and that's a patient who's been using Lidex gel up until that point for a number of years. So when she came back for follow-up, she purchased actually 2 or 3, I can remember, gels, because she said that the gel you gave me, and I gave her specifically just for that biopsy site, has helped me tremendously, more than the Lidex gel you've been giving me for years. So again, that's a few patients more anecdotal. We're actually, I think the company is looking at some of the controlled studies.
Excellent.
Specifically, actually, in the University of Texas, if I'm not mistaken, looking at autoimmune conditions and treatment with the gel and the rinse.
Okay. So there are a few questions here that are somewhat duplicative, if that's correct use of the term, to prior questions. Not duplicitous. Does Stella Life, I just touched on this briefly, maybe you can elaborate. Does Stella Life offer my team training to help ensure the best result for my patients in practice?
Absolutely. Without training the team, and I know Doctor touched on it lightly, when he first started with the product, obviously being so excited about the results in comparison to things that didn't produce the same results, educating the team and getting them on board is what creates the success, because as he mentioned, he was away somewhere and his surgical assistant was able to recommend the proper protocol because they were all on the same page. And that's something that in helping offices become more effective and streamline all these systems that they try to integrate based on educational opportunities like this, or going to a trade meeting, or having a consultant come in. Segueing the implementation is what's going to create the best success. So yes, there is training.
Debbie, if I may, and I appreciate taking a question, if I may add something as well. Having the benefit of using this product for 2 years, I also had an opportunity to observe my clinical staff, and it is amazing when they see how the product performs and how patients benefit. It's amazing to see how they get excited about the product as well. So they start talking about the product to the patients even before I get a chance to mention anything, because they want our patients to have full benefit for their recovery, and it's just amazing to see that on a daily basis.
Brief question. I know this isn't a presentation on this, but someone did ask you to how they could learn, Debbie, how they could learn more about the breathometer. Shall I have them contact you directly?
They can call Stella Life. I mean, they have all the information about that. But yeah, that's no problem whatsoever.
Okay, great. Okay, we're winding down here. What are your thoughts? We've talked on this, but if anyone wants to elaborate, I'll just share the question. What are your thoughts for long-term use?
Well, I think
it's been covered, I think.
Well, it's not. It's, I think, I hear this all the time, especially from the hygiene team. Is I don't want my patient to have to quote unquote buy something forever. When we understand the cause of the problem, and it's maintaining optimal biofilm levels and having the patient utilize something to keep the cause of the problem from coming back, again, like the benefits of using the Stella Life rinse to diminish 99% of strep mutans. You can fill a tooth once. It doesn't ever mean that tooth will never become infected again and need more therapy. So utilizing something in a preventive manner, I think, is ideal.
All right, that's about all we have time for. I see, Debbie, that you've been responding to people's questions as they've been asking them as well. So thank you for really doing yeoman's work, and I want to thank you and Walter as well for, I think, what I can only be described as a truly awesome presentation. I enjoyed every minute of it. This is really important stuff, and I don't know how you came up with it, Walter. I know that you're a brilliant man and you were motivated with a desire to help patients, and I think we're going to be able to do that. We're already doing it, and I'm excited to help get the word out, share it with as many people who will listen. I look forward to sharing the platform with you at the end of February when we speak to the Midwest Society of Periodontists, which will be concurrent with the Chicago Midwinter meeting, along with Dr. Stoner. So I'm looking forward to that very much as well. In a few days, you all will receive an email with instructions on how to apply to receive your CE credit. And I now want to invite you to please mark your calendars for our next webcast, which will be on Tuesday, February 21st at 6:30 p.m. Central Time. My very special guest at that time will be Rachel Wall, whose presentation is entitled Know Your ROH, that is Return on Hygiene, and Unleash Your Hygiene Team's Potential. Until then, this is Danny Bobrow thanking you, as always, for your continued commitment to practice perfection. Goodbye, everybody.
Good night.